I'm Dr. Greg Nigh. Thanks for joining me again for an edition of the Deep Dive. And I've already done one prior video about a process called PCR, polymerase chain reaction. And that is a lab technique that was first developed back in the early 90s and was initially used around HIV and viral load. And it came to be very widely used in biology and medicine, and most recently with COVID. That's the topic mainly in my prior video because the use of it as a diagnostic tool is great. PCR was never intended to diagnose any kind of infection. It's just a technique developed by Kary Mullis. He got a Nobel Prize for it. And it's a technique for amplifying very small fragments of DNA. And so these are fragments that are too low to detect by other methods. And so you do this process of an exponential amplification of small amounts that are there. And then you make those small amounts big enough that you can actually detect them to find out if it was present. So if there was none of it present, then you do that technique, and if there's still none present, okay, there was none of that DNA there. But then if you amplify it and find that, oh yeah, we found some, then you can calculate back to figure out how much was there initially. Okay, that's all background. The point of this particular talk has to do with the use of PCR when people are doing gut testing. They do stool tests. And for anyone who has been working with a practitioner to try to get their gut fixed, it is widely used that practitioners, I am among them that have done this, order a stool test, because you can get all kinds of functional information about what's happening in the gut by doing a stool test. The problem, though, is so when you run these tests, and there are various companies, and they essentially all of them are utilizing PCR to identify the different kinds of bacteria resident in the gut. So what's really happening? Well, and this is the reason that as I've written and talked extensively about, I'm skeptical of stool tests. And it's largely for what I'm about to explain. So how does this happen? Well, in order to do PCR, you have to develop what are called primers. And these are little bits of complementary DNA that stick to the target that you're trying to identify. So you have this long beads on a string sequence of bacteria DNA, and you want to know if any of that DNA is in your gut. So you have this. Well, you develop primers that will stick to two spots on that DNA, and then PCR allows you to replicate over and over the DNA between your primers. And so you run it through a whole bunch of cycles, and if you end up finding that, oh yeah, the primer stuck to something, then the conclusion is that yes, that bacteria was in your gut. So what are the primers sticking to when you do this kind of testing on guts? Well, what they're sticking to is a very, very small region of the full bacterial DNA. How small? Between 0.005 and 0.05 of the full bacterial DNA. So we're talking about it's just binding to and amplifying a tiny, tiny fragment of the full bacterial DNA. And if it finds that tiny fragment, it reports it on the test results that, oh yeah, we found this many copies of Desulfo Vibrio or E. coli or all kinds of things that they test for with these tests. But they're not looking for live, active, replicating bacteria. It can't. It's not capable of doing that. It's just finding this tiny, tiny fragment of the full bacterial DNA. And if it finds that fragment, it reports it on the test that, oh, we found this many copies of that kind of bacteria growing in the gut. And so, you get those reports back and, oh my gosh, it's flagged high on Klebsiella and E. coli and Campylobacter and blah, 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 all kinds of things that might be found in excess or deficient when they do PCR on the gut. So I hope with that description, you can see why I'm a little bit skeptical of what those tests are really telling us. They're not telling us about the bacteria that are living in the gut. And I'll get to a second problem in a minute. It's telling us about fragments of DNA that are found. So again, what if you actually have a competent immune system in your gut? Some of this bacteria comes in, your immune system does its immune thing, your stomach acids do their thing, and your protease enzymes and other things, kind of digest that bacteria. And you break it up into fragments. And one of those fragments actually has that 0.005% of DNA that PCR is looking for. All right, well, you just amplified that, and now the report is going to say, yep, you've got a whole bunch of this bacteria in your gut. When you don't, you actually have a whole bunch of fragments of that bacterial DNA, some of which got amplified on the report. Okay, that's one problem. A second problem is that, so there are different compartments within the digestive tract where the various bacteria live. There's a stomach, it's got its resident set of bacteria. There's a small intestine, which SIBO, and oh my gosh, SIBO, so many people diagnosed with SIBO, small intestine bacteria in the small intestine that aren't supposed to be. And then where, the large majority of bacteria are living are in the large intestine. They don't just all live kind of in this big space where they're all occupying all the spaces. There is the bacteria that are in the lumen, which is to say the stuff going down the tube. And then there's the bacteria that live in the lining. And those can be separate populations of bacteria. And in fact are with many bacteria types. The ones that are in the tube are not the same ones that are setting up shop in the lining. Stool testing is telling you what's in the tube. It's not telling you what's in the lining, or not always telling you what's in the lining. And so on these tests that I have run, stool tests, and I'll tell you why I run them in a minute, but commonly in these tests, what happens is, and this is, anybody can see this who's looking at the report. The PCR result will say, oh, there are, 3 times 10 to the 5th lactobacillus found. And I'm just making up a number, but so they find the DNA by doing PCR, this many. And then in another part of the same report, they culture, which is they take some stool and they put it on a petri dish and they grow bacteria to see what kind grows. It is almost without exception. And I say almost because maybe there's been one over the years that I'm not remembering. Essentially, every single time there is the PCR saying, yep, we found a whole bunch of lactobacillus. And when they try to culture bacteria, 0, none grown. They cannot culture any lactobacillus. How will that happen? How could there be a whole bunch of PCR reported bacteria, but you can't grow it? Well, it's because PCR is not identifying living bacteria. It's identifying bacterial fragments, just DNA fragments. So in my mind, what's much more valuable in terms of doing stool testing is to do culture testing, where they are trying to grow the various bacteria, because that's telling you the living bacteria that are inhabiting the gut. So, something that I do find valuable about doing stool testing is that in addition to telling you what kind of bacteria are there, and there are many other reasons that I think it is a red herring to chase specific kinds of bad bugs that are found on stool testing, and that'll be a topic for other times. But what you can find with doing that kind of testing are other valuable bits of information, such as how efficiently somebody is digesting fats, proteins, carbohydrates, about inflammation levels, calprotectin and other markers for inflammation in the gut. Can tell you about zonulin and markers for leaky gut. That can be quite helpful to know. Can tell you about secretory IgA, which is the main antibody that is sort of built into the gut lining. And so if secretory IgA is either low or high, lower or higher than it should be on average, it's telling you something important about the function of the gut. So the punchline is, to reiterate what I have said many times, I find gut testing to be of limited value. I'm not saying it's of no value. I think it's of limited value. And I think it can become problematic because patients kind of see the PCR result of the type of bacteria that's shown in excess or deficient or blah. They see that and it becomes this sort of like it's just believed to be the state of their gut. Okay, I've got this overgrowth of Klebsiella. What am I going to do about it? Well, we don't know if you got an overgrowth of Klebsiella. What we know is you have a tiny bits of DNA that are associated with Klebsiella that are found in your gut. Anyway, there's a long backstory around how then I personally think about approaching treatment, which is not focused on killing particular bugs, because I think our guts are way more intelligent than we give it credit for. And so there's a different kind of approach that takes into account what our guts are trying to do by growing or suppressing various types of bacteria. So I hope that kind of gives an overview of a different way maybe of thinking about using PCR for testing what's going on in the gut. I encourage you to subscribe to this podcast. I'll be doing a whole lot more of these in the coming year for sure. And like it and, all that stuff you do to make sure it gets out there. Tell all your friends about it and repost it and all that. So I will be back before too long with yet another exciting edition of the deep dive. And if any of you have suggestions about topics that you would like me to dive into, please do put them in the comments. I will monitor those and take that into consideration. All right. Thanks so much.